Is Botox safe during pregnancy and breastfeeding? If you ask most injectors of all experiences, the common pattern is that we avoid injecting pregnant or breastfeeding patients. But is this backed by science? And are Botox and other similar neurotoxins safe for these patients? The short answer is actually yes. I'm Dr. House, a facial plastic surgeon in the San Francisco Bay Area. It's going to be a bit of a numbers-heavy video, but let's go over the data. I'll put the citations in the description below so you can check it out yourself. But to summarize, the median lethal dose for humans has been estimated about 2 nanograms of botulinum toxin per kilogram of body weight. That's about if you have a 10-pound baby, it's about 200 units of Botox injected directly into the baby, which is much less than we'd even use for cosmetic Botox in adults. So we've talked about this before, but the mechanism for the metabolism of Botox is unknown. It's likely synapse recovery, meaning that the effects of Botox last as long as it takes for the motor nerves to reconnect to the muscle cells. So we don't only know if it's cleared by lymphatic or hepatic or renal secretions, but we assume it gets degraded and excreted pretty much right after it's injected, at least in the next few days. So now looking at the therapeutic mechanisms for the average adult, it's around 400 units of Botox. In cosmetics, we use much less, around 30 to 60 per treatment. The lethal dose is about 3,000 units for a single treatment, so we're far below that. As far as the chemical structure of the botulinum toxin, when it's injected in that form of Botox, it's around 900 kilodaltons or 800 nanometers, which is much larger than the placental blood barrier, which is around 240, so it's likely not to cross. There have been animal studies done on Botox in pregnant rabbits and mice. The only adverse effect was a low birth weight in the rabbits. There was no adverse effects noted in the mice, so it's kind of inconclusive. So there have been several case reports of pregnant patients being inadvertently injected with Botox, meaning that they didn't know that they were pregnant in the first, second, or third trimesters. There's also a case report of 7 pregnant patients who contracted full-blown botulism in either their second or third trimester. There have been no evidence of birth defects or infantile botulism in the neonates in any of those cases. And in fact, in one case, the maternal paralysis was so severe, the fetal movements were the only visible movements in her body. So overall, there's no evidence that Botox crosses the placenta in humans. And not only that, but there's no evidence that the Botox molecule ends up in your circulation with cosmetic treatment doses. And this is true also for breastfeeding. So it's unlikely that the Botox would enter your milk, both based on the molecular size and dosage and the lack of measurable systemic distribution. Current data suggests, but does not entirely confirm, the Botox toxin doesn't attain significant systemic concentrations if correctly injected into the muscle or into the intradermally. This is why it's important to go to a provider who's well trained and experienced in neurotoxin usage and somebody who you trust. Based on a 24-year retrospective review of the Allergen Safety Database, the prevalence of abnormal pregnancy outcomes in mothers who have been exposed to the Botox, the botulinum toxin, prior to or during pregnancy is consistent with the background rates in the general population. So there's no consistent types of malformation of organs or any other birth defects that have been noted. There's no safety concerns that have been brought up since then. So to summarize, based on the data we have, Botox treatments while pregnant and breastfeeding is almost certainly safe. However, this is a cosmetic treatment, it's an elective procedure, it's not necessary. So even if there's a 1 in a trillion chance of it affecting the baby, most providers tend to not inject pregnant or breastfeeding patients for this reason. Big picture though, if you did get cosmetic Botox treatments while pregnant, didn't know you were pregnant at the time, your baby is almost certainly going to be fine. So it's really a discussion between you and your injector and the comfort of that injector with the data that I've just shared with you. If you have questions or comments, leave them below. Again, I'm Dr. House. Thanks for watching. I'll see you next time.